The three payment avenues and for the model is, number one, practices still bill fee-for-service for all services rendered. So physicians will be able to bill E&M. They are able to bill for any other services, labs, hospice, so anything that falls under that bucket. So in addition, CMS is providing $160 per member per month as a MEOS payment, which is the monthly enhanced services payment. And really the goal with that payment is to provide resource to the practices for practice transformation activities, i.e. hiring support services navigators, establishing patient-centered programs, et cetera. So the whole goal with that $160 per member per month is to ensure that that money goes towards practice transformation. Now, what's interesting is that the MEOS is actually part of the total cost of care. So it's actually accounted for as an expenditure at the end of the day when they do the reconciliation. So what's tricky about that is that if they overbill for MEOS, if the practice overbills for MEOS and during the reconciliation process, it's determined that they overbilled for MEOS, meaning they billed more MEOS payments than they actually had beneficiaries within the program, then they actually claw back some of those MEOS payments. And that can be quite significant if we're not careful. And that just leads to another issue called attribution, is, you know, what patients are actually attributed to the program. So that's been sort of a very difficult thing to ascertain and adjudicate in the here and now. So there's that 160 monthly enhanced payment. So the third aspect is that performance-based payment. And so a practice will earn a performance-based payment if their expenditures are below their target price, right? If their expenditures are above their target price, then they will not be making a performance-based payment. So a performance-based payment is given twice a year. So reconciliations happen twice a year, about 15 months after the end of the performance period. So there's quite a bit of time and data lag between the end of the performance period and when the actual reconciliation comes out, which is another issue that's been difficult for practices, because it's hard to make immediate changes and it's hard to know what you need to improve if the data lag is that long, is over 12 months. CMS does put out feedback reports that does have some information, but you can't hang your hat on it, so to say, but it does provide a good checkpoint in terms of where they're standing or where they're trending to. And that report usually happens, you get your report about 3 months after the end of the performance period. So it's a little bit better than waiting the 12 months, but it's still not ideal. Definitely not ideal. So that's been very difficult. But essentially, to answer your question, is those are the three mechanisms for payment within the model.